The American Diabetes Association published new guidelines for lifestyle changes to help people with type 2 diabetes. Are there any big changes? Well, not really, but there are some important details that I think should be pointed out that can sort of help emphasize what are some of the most important concepts. I'm Dr. Brett Scher, the medical director at dietdoctor.com, and this was published in December of 2021. But the specific part I want to talk about in the standards of care is facilitating behavior change and well-being to improve health outcomes. Standards of Medical Care in Diabetes 2022. And they come out with these updates, I think every year, every couple of years. And, not a whole lot changes from year to year, but low-carb diets and the importance of carbohydrates and the importance of food quality really has sort of risen to the top as being an option. So let's go over some of the specific parts in here. And they talk about, at first the outline of what they think is most important. And right off the bat, they talk about the importance of self-management education and support for people with diabetes, and saying all people with diabetes should participate in self-management education and receive the support they need to facilitate the knowledge, decision-making, and skills mastery for diabetes self-care. And that's a lot of words. What exactly does that mean? Does that say anything? Well, what my take home from that is, look, not everybody knows how to take care of diabetes themselves, especially if at their doctor's visit, they're given a prescription and they say, here, this is what you need to take for your diabetes. See you later, right? Or if they just say, lose weight, eat better, be healthier, and here's your prescription, good luck. Unfortunately, in a really rushed doctor's practice who doesn't have allied professionals who can help the doctor, that may be all you get, and that's really sad. That's not the way medicine should be. But what they're saying here, and I really like that they're emphasizing it, that we need to teach people how to take care of their own type 2 diabetes, how to check blood sugars, how to understand what's causing your blood sugars to rise, and specifically how to implement behavior changes that are going to work for you and stick long term. That's sort of my take home for that. And that's a big thing about what we're about here at Diet Doctor, is that working with you to give you a nutritional profile and a lifestyle that's going to work for you. We can say, look, ketogenic diets work. We can say vegan diets can help. But the question is, are either of those going to stick and work for you? And that's where, the details matter, right? And so I think that's sort of what they're getting at. And then they talk about the different times that self-management education is really needed. And that's at the time of diagnosis, and then annually, or when someone's not meeting their targets, when complicating factors develop, and when transitions in life and care occur. And I guess the point there is that, look, life's not a straight line, right? We're going to hit bumps. We're going to hit roadblocks. Things happen in life that throw us off our path. And that's when it's important to sort of be brought back in. And again, your doctor may not be the best person to help you with that. That's where a coach can be so helpful. A community can be so helpful. Like on our Diet Doctor app, our Connect group, or our Facebook group, or any of the online groups, to have accountability partners, to have support people, whether it's your family, your friends, or an online community, to really help you when life throws you a curveball, because it's going to happen, right? So the key is to not be caught by surprise, but to have something in place to help you get back on track. So I like that they're really talking about that. And then when it comes to nutritional therapy, they're very clear. There's not a one-size-fits-all eating pattern for individual with diabetes, and meal planning should be individualized. So that's great. That's true. But then what do you do with that, right? Like, there has to be some sort of standard, or at least some generalized concepts to base your diet around. But then absolutely those general concepts should be individualized, like they're talking about. And they state the goals of nutrition therapy for adults with diabetes should be to promote and support healthful eating patterns, emphasizing a variety of nutrient-dense foods in appropriate portion size to improve overall health, and achieve and maintain body weight goals, attain individualized glycemic, blood pressure, and lipid goals, and delay or prevent the complications of diabetes. So nutrient-dense foods in appropriate portion sizes. So right away, we're talking about a diet that's going to keep you full so you can manage your portion sizes. And that's something that's so interesting here in the United States and in other parts of the world as well, that portion sizes have really gotten out of control. I think in a general comment, it's probably less bad in Europe and Scandinavia than it is in the US, but I think it's getting bad everywhere. And part of that is if you're eating a diet that's not satisfying to you, and doesn't help you feel full, that you're going to eat more. And so that's something that really needs to be addressed, that the dietary pattern that people choose should be one that is going to help them naturally control their portion size and not have to count calories and struggle and measure and do things that you really have to hyper focus on your food and purposely try and restrict your calories, because I think we've seen that that doesn't work. But then they also say to address individual nutrition needs based on personal and cultural preferences, as well as health literacy and numeracy, access to healthful foods, willingness and ability to make behavioral changes, and existing barriers to change. So I love that about personal and cultural preferences. And that's a statement that I also think is lacking in so much of the nutritional conversation today, that everybody has to go vegan or everybody should go keto. And no, I mean, your personal and cultural preferences definitely play into that. But that doesn't mean if your personal and cultural preferences are, bagels and donuts and cookies and pasta, and that you should be allowed, it's okay to eat those because that's your personal and cultural preferences. No, that doesn't quite work that way. But to try and presume that we can make everybody go plant-based, that's just so short-sighted, especially when the evidence against animal products is so incredibly weak. And the same thing, saying everybody should be eating more animal products to get enough protein, well, that's negating the personal and cultural preferences for people who don't want to eat animal products. So instead, making sure they can get adequate protein and adequate nutrition without animal products. It's certainly doable, but it's just so easy to fall into the black and white, good or bad kind of prototype, rather than bringing in the nuance. So it's nice that they're talking about personal and cultural preferences. We just have to understand that there's a limit there. And next is providing non-judgmental messages about food choices. So this is really interesting, non-judgmental messages about food choices. So like saying, if you're eating sweet potato and fruit, oh my God, how can you do that? That's terrible. Well, no, maybe that's not so bad. But at the same time saying you're having a steak, oh my goodness, that's awful. Look at what you're doing to your health. No, I mean, that's clear. Those are clearly overly judgmental. And so I like that they're getting at it there, but hopefully people realize it goes both ways from the judgmental, because I don't know, the way I read this was they're saying don't demonize carbs, but I would say at the same time, don't demonize animal products, because the science isn't there to back it up when it's part of a healthy, low carb, sustainable diet. And then last, they say to provide an individual with diabetes the practical tools for developing healthy eating patterns rather than focusing on individual macronutrients, micronutrients, or single foods. So healthy eating patterns rather than focusing on individual macronutrients. Well, what if the macronutrients are sort of part of a healthy eating pattern? So again, I think, I don't know, maybe I'm being too sensitive here, but I think that's sort of also an attack at low carb diet, saying don't focus on low carbs, just focus on healthy eating patterns. But for some people, focusing on low carb is going to be their healthy eating pattern. And that's perfectly fine. Not that doesn't have to be the case for everybody, but for some people, that's going to be perfectly fine. And some people, it's going to be focusing on whole foods rather than packaged or processed foods. That's perfectly fine too. So again, it comes down to the approach that's right for the individual. And I like how when it does come to carbohydrates, they say regardless of the amount of carbohydrate in the meal plan, focus should be placed on high-quality, nutrient-dense carbohydrate sources that are high in fiber and minimally processed. Well, that makes a lot of sense. So really focusing on above-ground vegetables hits that to the T. And I think that should be the focus of the overwhelming majority of carbohydrates in most people's diet, with some low sugar fruits involved. And if you really want to expand more carbohydrates, then some root veggies and maybe some legumes. But what that does tell me is that the grains and certainly the processed grains and the processed carbs, again, the pastas, the breads, and any of the sweets, those have to go. So it's nice to see that, because let's be honest, the American Diabetes Association, some of what they promote for their recipes online don't fit this statement right here, focusing on high-quality, nutrient-dense carb sources that are high in fiber and minimally processed. But I totally agree with that. that should be the focus of carb quality. And if we start with that, wow, that's a huge victory right there. And that's a big improvement over what a lot of people are eating. And then again, they recognize the importance of low carb diets. So reducing overall carbohydrate intake for individuals with diabetes has demonstrated evidence for improved glycemia and may be applied in a variety of eating patterns that meet individual needs and preferences. So the importance of reducing carbs and fitting it into individual preferences. For people with type 2 diabetes, low carbohydrate and very low carbohydrate eating patterns have been found to reduce A1C and the need for anti-hyperglycemic medications. So again, this is important because a number of clinicians, whether it's physicians or nutritionists or dietitians, may feel like they're kind of going out on a limb by using low carb diets and recommending low carb diets. But here, a statement from one of the biggest diabetes organizations in the world is recognizing the scientific evidence supporting very low carb nutrition for helping people improve their blood sugar. So I think the days of people feeling like they're out on a limb recommending something that's not guideline-based or science-based is gone. So that's really encouraging, so that people can now start to focus on using low-carb nutrition and very low-carb ketogenic diets as a tool, right? Not necessary for everybody, but as a tool to help people improve their diabetes and their lifestyle. And of course, the other underlying theme here is behavior change that you can sustain, right? Not a behavior change that is torture, not a behavior change you don't like or that is too logistically difficult for you. Not a behavior change that's going to last for a few weeks and then you're going to have to give up on, but a behavior change that you can sustain. And that's another message that's just been missing in the medical community, that there's a right and a wrong way to eat. But no, there might be a right and wrong way to eat for you, but it's not the same as for your neighbor. It's not the same as the person you saw on social media. And that's what we really want to help people with here at Diet Doctors, to help people find a sustainable way to eat low carb. Yes, we focus on low carb, but that could be 130 grams of carbs, 100 grams of carbs, 70 grams of carbs, or 20 grams of carbs. Whatever is right for you and your situation, and finding a way to make it delicious, to make it sustainable, to make sure you're not hungry, and to make sure it's addressing your metabolic health in addition to your weight. So those are the key factors. So hopefully we've got the materials for you at dietdoctor.com to get you started. I was encouraged by seeing this publication by the American Diabetes Association. A lot of these messages are really important, and we'll continue to help you with them here at Diet Doctor. So thanks for joining us on Diet Doctor News on YouTube, and we'll see you next time. If this was helpful, please click thumbs up and subscribe. Leave us a comment. We love to hear from you. All right, take care, everybody.